Hi, it's Mr. Baker here with another physics video. Today we're going to be looking at X-rays in medicine. Okay, so today we're going to be looking at X-rays in medicine and we're going to be answering these questions. Do I get a larger dose of radiation when I'm in a plane? And if so then, is it safe to fly? Right, so we're going to be playing a game to start off with. We're going to be playing Guess the Animal. So, pause the video there, see if you can guess the animal. Just for a couple of seconds, I'll tell you in a second. Okay, so can you guess the animal? So number one. What have you got? Shout it out. Very good. Yep, seahorse. Number two. Did you get that one? Duck-billed platypus. Hope you did. Number three. What's this one? So this is actually a cat. Number four. What did you get for that one? Yep, a little, I think it's a spider monkey, something like that. It's a little monkey. So all of these things are X-rays. Number five there, jellyfish. Well done. Number six. What have you got for that one? Did you get penguin? Well, if you did, well done. Hope you got 6 out of 6 for those. But really, what I wanted to show you is that these are all X-rays. These are all X-rays of different things. And so I'm sure you've seen an X-ray before. But what an X-ray does is it gets stopped by bone. And so it doesn't get through that, but it will go through everything else. And so because of that, then we can see where the dense material in our bodies are. So how can X-rays see inside stuff then? So the X-rays are made in the X-ray generator. The X-rays then are projected through the patient, through the object that you're trying to look at. They'll be absorbed by the bones but then pass through all the soft tissue. The X-rays that get through will be detected by the X-ray detector. The detector will then convert those signals into an image that can be seen. So how to make an X-ray? So this is what you'd need if you want to make an X-ray. So you need a source of very high voltage. When I mean very high voltage, I mean 5,000 to hundreds of thousands of volts. So you'd have that there. That would go to an anode, so a positive electrode on one side, which would be attached to a tungsten metal target. So on this side then, the electrons would move to a cathode. So this would be a cathode. They would be boiled off the cathode here. They'd be heated up. And then electrons, because this would be a massive voltage of hundreds of thousands of volts potentially, they would be attracted to the anode through a vacuum and they would accelerate at really high speeds, hit into this tungsten target, and then that would make X-rays here, which would then be generated and go through this little window, and all the way around this blue line here, this kind of blue box here, would be a lead lined box. So X-rays couldn't go anywhere else. They'd have to be projected down through into the target, into the object that you want to look at. So how can X-rays see inside stuff then? So X-ray images can be taken because X-rays can pass through opaque materials. X-rays pass through soft tissue such as skin and muscle without being absorbed. Denser tissue such as bone can absorb X-rays. Film that's exposed appears black, and areas that are not exposed because of X-ray absorption appear white. So here's a couple of examples of X-rays. Two views of a finger on the right hand. The dislocation can be clearly seen at the joint, and you can see it probably better in that lower one there. Metal absorbs X-rays, so it shows up really clearly, as you can see there in that bone there. And here we have an X-ray of a skull with a fracture. You can see that the fillings there in the mouth, you can see those. And with a bit of computer enhancement, you can actually also see the soft tissue. A CAT scan or a CT scan has multiple X-ray images and can be combined to give a 3D image. It's called a CAT scan because it's computerized axial tomography. Tomos is Greek for a slice. And you can see in that top left image, what happens is that the X-ray takes slices through the body and those can be joined together to create 3D pictures. A doctor can also analyze each individual slice to see changes in the body. Now, materials that absorb X-rays can be used to show soft tissue because soft tissues won't absorb the X-rays, and these are called contrast media. Here, barium sulfate has been injected into the colon. X-rays would normally pass straight through the colon, but the contrast medium absorbs the X-rays. And so this is used to see if there may be blockages in different areas of the body that otherwise X-rays wouldn't be able to see. What do X-rays do to cells? So X-rays are ionizing, and so because of that, if they are absorbed by atoms in the DNA of cells, then they could potentially kill off those cells. They could also cause those cells to potentially mutate or reproduce and cause cancer, depending on the dose. And what is a dose then? So here we have a scale of radiation dose in millisievert, and it goes from 1 up to 1,000 millisievert. So if I show you some different doses, so 1,000 here, 1,000 millisievert, this is a dose that may cause symptoms of radiation sickness. Just over 100 here, this is the average exposure to astronauts working at the International Space Station. It's actually 150 millisieverts. The next one then is a typical chest CAT scan, which is about 7 millisieverts. And the next one here is the average annual dose from natural background radiation from living in the UK, which is about 2.7 millisieverts. Here is a typical chest X-ray, which is 0.1 millisieverts. And then the last one, typical transatlantic flight, about 0.05 millisieverts. So 1 sievert is 1,000 millisieverts. 1,000 millisieverts can cause radiation sickness. A normal X-ray has a dose of 0.1 millisieverts. A specific CT scan is 7 millisieverts. A full body CT scan could be 30 millisieverts or more. A cumulative dose of 1,000 millisieverts would probably cause cancer. There is documented evidence associating an accumulated dose of 90 millisieverts from 2 or 3 CT scans with an increased risk of cancer. So special precautions must be taken for the person having an X-ray. Only the area of the body being examined is targeted with X-rays. The other X-rays are protected with lead shields, which is too dense for X-rays to pass through. To minimise their exposure when an X-ray image is being taken, radiographers must wear a lead apron, stand behind a screen that absorbs X-rays, or even leave the room. One-off X-rays do not pose much risk to health. Radiographers take several X-rays each day, and their potential dose is much higher. So these are the things you should be able to do after this lesson. Then you should be able to state how X-rays can be used in medicine and describe how X-ray photographs are made. You should be able to describe some safety procedures when using X-rays. You should be able to describe the operation of X-ray equipment and describe in detail how X-ray photographs are produced. You should be able to describe how soft tissues may be viewed with X-rays, and you should be able to compare CT scans to normal X-ray photographs and evaluate and explain safety procedures for different doses. So we asked at the beginning of the lesson, do I get a larger dose of radiation in a plane, and is it safe to fly? So a pilot makes about 120 transatlantic flights a year. Each flight causes a dose of 0.05 millisieverts. Having a one-off dose of 90 millisieverts can increase the risk of getting cancer. So is the pilot at risk? So 120 transatlantic flights, each of them 0.0 millisieverts. That equals a dose of about 6 millisieverts. So it poses a very small risk. So it's safe to be a transatlantic pilot. Okay, so that's been another physics video all about X-rays. I've been Mr. Baker, and I'll see you next time. Thanks very much.